Now, I know that you're very proud of the state slogan in New Hampshire, live free or die. That's a great slogan. And if you're thinking of a slogan that just summed it all up and you were pained by the word, that captures it all. But I think the Democrat slogan coming out of Washington and elsewhere around this country should be, basically, as they propagate their policies, the Democrat slogan is, grow government and stagnate. And it's basically their perspective. Grow government and stagnate. Let me give you some examples. I won't go through them all, but let me give you a couple of leading examples, starting with the out-of-control, reckless, irresponsible, unsustainable federal spending. The federal government is running a Ponzi scheme on the Potomac, and it needs to come to an end. And we've seen this movie before. As we look back in retrospect on the savings and loan crisis, people say, we could see that coming. Why didn't somebody sound the alarm? Why didn't somebody do something? Why didn't we rise up to stop it? It didn't happen. And then we saw the dot-com bubble develop and burst. People look back and say, why didn't they see it coming? Why didn't we sound the alarm? Why didn't we do something about it? And then more recently, and even more painfully, we saw the subprime mortgage crisis. And we look back on it now. The foibles of Freddie Mac and Fannie Mae, and all the rest of the behavior underlying the Ponzi scheme. We look back and see it very clearly now. Why didn't somebody see it coming? Why didn't they sound the alarm? And now we know the federal government, through their spending and their actions, running a Ponzi scheme, cannot be sustained. We know what's coming. We need to rise up. We can see it coming. We need to sound the alarm, and we need to stop it. We got the federal government equivalent of the subprime mortgage crisis occurring and unfolding right before our eyes. This is no longer a matter of conservative versus liberal. This is no longer a matter of right versus left. This is now a matter of basic mathematics. And let me give you a few of the numbers. Our federal government, in rough terms, takes in about $2.2 trillion a year in revenues from all sources. This year, they're going to spend $3.7 trillion. So they're overspending what they're taking in by $1.4 trillion. That's just in 1 year. If you add up all the cumulative debt in the country, in terms of the budget, it's about $11 trillion on revenues of 2.2. But here's the clinker. Here's the cincher. If you look at all the unfunded liabilities of the federal government, and you include the entitlement programs, and you include the pension programs, and you include all of the stuff that we are obligated to do for the public employees, and on down the list, it's not 3.7 trillion. It's not 11 trillion. It is $65 trillion and climbing exponentially. Now, if you do the math on that, that's over $500,000 of debt per household in the United States of America. $500,000 per household. Now, you know what this means. Our country, our beloved United States of America, can't pay its bills. Now, when you see the United States Secretary of State in communist China, as she was recently, pleading with the Chinese to buy our debt, because if they don't, and other sovereign wealth funds don't around the world, we can't pay our bills. That is not the United States of America that we want. The United States of America is not a beggar nation. Hey, we need to get our bills in order. Another example, of course, which is all the talk on the news and in the country, is the healthcare situation. There's no doubt that our healthcare system is busted. It is breaking the financial backs of individuals and families and small businesses and governments. If you want to see one of the main driving expenses for school districts, for counties, for cities, for states, certainly the federal government, of course, so much of it is the runaway costs of healthcare. So we need to fix it. But we need to do that in the right way. President Obama stood here in New Hampshire on the eve of the New Hampshire primary and said that he was going to join with Republicans and Democrats, and on a bipartisan basis, he was going to fix the health care system, and with cost containment being the number one objective. So here we are, gathered as conservatives, gathered as Republicans in New Hampshire. And the words ring out from President Obama here on primary night. Republicans and Democrats solving this together. And what has he delivered? He has taken a liberal monstrosity, a partisan liberal monstrosity, which is the Democrats' health care reform proposal, and is jamming it down the country's throat. That's not what he said here on the primary night. That is not living up to the words that he said. Now, he gave a speech to the joint session of Congress not long ago, and he said he's going to call out people who challenge him on health care. And guess who the first person in the country was to be called out on the Democrat National Committee's website on health care? Your speaker here tonight. So, I'd like to return the challenge and call him out. Today, he said, I don't know if you saw the news, but he had a recorded interview with Charlie Gibson. He said to the effect, if we don't fix this healthcare system with cost containment, it's going to bankrupt the country. It's going to bankrupt the country if we don't slow down or reduce healthcare costs. Now, keep that in mind as I tell you this. The Federal Health and Human Service Department, or agency, part of the Obama administration, recently came out with a report that said these proposals will cost more, not less, in healthcare spending in this country. This is the biggest bait and switch tactic in the modern history of American politics. If we have as the number one challenge the runaway costs of healthcare, then success on the reform needs to be measured by, is healthcare going to be more affordable? Are we going to save money? Are we going to spend less? This is a bait and switch tactic. If we're going to reform healthcare, what we need to do is not have the federal government take it over. We need to empower consumers. We need to empower families with good information about healthcare costs and healthcare quality, and then give them financial incentives, and if need be, financial help to the extent we can afford it, but in a marketplace to make their own choices. Now let me tell you about how we have